Some studies suggest that there's an increased risk for cardiovascular events with synthetic calcium supplementation. So this is really important. Synthetic calcium supplementation, that includes calcium carbonate, calcium citrate, and microcrystalline hydroxyapatite. Why do these synthetic calcium supplements have an increased risk for cardiovascular events? Well, studies show that after a bolus dose, so 500 milligrams or 1,000 milligrams of these synthetic calcium supplements, we see a rise in blood calcium levels, and that stays elevated for up to 8 hours post that dose. As shown in this figure here, calcium carbonate, calcium citrate, microcrystalline hydroxyapatite, MCH, you see a rise in the calcium, and it's sustained for up to 8 hours. But when you compare that to what happens if you consume dietary calcium or calcium from food, for example, in this study, they consumed milk calcium, what happens is that you see a rise in calcium in the blood, but an appropriate and natural decline of that serum calcium over time. This suggests that the body is processing that calcium, so it's removing it from your serum and into the appropriate places like your skeleton. So the thinking is that the sustained increase in serum calcium or blood calcium with synthetic calcium supplements may increase the risk of cardiovascular events because the calcium is hanging around in your blood for longer than it naturally should. The conclusion from this recent review article by Ian Reid in the Current Osteoporosis Reports shows that clinical trials suggest that the risk of heart attacks is increased with synthetic calcium supplementation. And the major asterisk here is that that risk is not seen with dietary calcium or calcium from food, which is why it's recommended to consume your calcium from food versus synthetic supplements.